I think in addiction you hit a lot of rough patches, a lot of bottoms. When I hit my rock bottom, I had lost pretty much everything. I'd lost my job, I'd lost my home, I'd lost most of the relationships that were the most valuable to me. I lost my sense of integrity. And so in my recovery, those are the things that I've been able to rebuild and acquire, and to a better degree than what I had had before. So those are the stories, those are the things that I try to offer as hope and motivation. My name is Hillary and I'm a person in long-term recovery. I work for the Turning Point of Central Vermont, and I've been working in the emergency department since fall of 2018.
Emergency rooms are an incredibly central place in a community.
We have treated addiction and issues around substance use disorders for a long time in the emergency department because a lot of times that's where it manifests first.
Substance use disorder is a peculiar kind of brain disease. Something clicks in their brain, and the brain says, "Where have you been all my life?"
For much of our career, we would see this huge need, but we had no resources, no pathway, no way to dig into it. It was either you're sick enough to be in the hospital, or here's a phone number you can call, and maybe you're lucky enough to get somebody to see you in a month.
Shame prevents people from asking for help. You know, it prevents people from even admitting that they need help to their own selves.
A stigma is internalized by the person with the addiction, and that's what kills.
We want to do this stuff all on our own, and the truth of the matter is we need each other, and we need the community to be supportive of this healing process.
So back in 2013, we said, what could we do differently?
And there were some good evidence-based things out there, so we applied for an SBIRT grant back in 2013.
That trained people at the hospital, doctors and nurses and social workers,
to screen for alcohol and drug abuse conditions as part of the regular triage process, really regardless of why you're in the ER.
And when they did that, they realized they didn't know where to refer people. They didn't know anything about the community.
We decided to bring those people together and form a countywide coalition that at the time we called the Washington County Substance Abuse Regional Partnership.
Now called Central Vermont Prevention Coalition.
It forced us to kind of get out of our cocoon and understand who our community partners were. And I still don't know who said this, but he said, treatment starts in a room, recovery starts in the community. Addiction and substance use isn't a CVMC problem. It's not an addiction clinic's problem. It's Central Vermont's problem.
Around the country, having a committed medical center is rare. And I'm so proud that we've been part of this work and that we've continued to be part of this work. With the rapid access to MAT, medication-assisted treatment for people with opioid use disorder, comes a durable connection to a peer recovery coach, a connection to follow-up services. That success with the peer recovery coaches working with the RAM program really has also led to peer recovery coaches and being in ERs around the state for all sorts of other substance use disorders, especially alcohol.
Often when I go in and see patients, once I introduce myself as a peer worker, there's an immediate sense of mutual understanding, and at that point is usually when the patient wants to open up and talk about what's really happening with their addiction.
Somebody who has that disorder, they've internalized, many of them, the social stigma, so they think they're low character, they're weak, they lack discipline, they're just not worthy. And the person who's been there can say, oh yes you are. I was like you at one point, but I'm not anymore, and you can be where I am too.
Equally as important is they show the staff in the emergency department, this is what recovery looks like. So we see patients usually at their worst when they're struggling. And now they see someone who comes in who is professional, engaged, collaborating with nurses, techs, providers. It just serves as a reminder that, hey, maybe this is what can happen if we can really help people along the way and get them into recovery and get them on a pathway to getting better. So it serves as a role model for patient and for staff of really what's possible.
Still remember the first time Hillary came running into my office. She said, Bob, a doctor just asked me for my opinion about a patient. So that's the other side of the coin. That's how it's benefited our coaches, and our coaches are stronger, they're better people, they're better in everything they do because of the work they do up there.
If we can bend that curve even just a little bit through programs like this and others, that is a huge win for our communities as far as people being able to get back on their feet and build productive lives. To me, it's the definition of population-based and value-based healthcare.
Living a sober life is the best thing that could happen. I do things that I wouldn't have normally done if I was still using or in an active addiction. I try really hard to meet each day as a new opportunity to do better, to reach people with the message that there is a better way to live, a easier way to live. It usually takes a couple times of trying, of learning how to live differently, and that's the reward, is the constant little increments of change and purpose and growth that I see with the people that I meet every day.